Bismillahirrahmanirrahim. Assalamu alaikum class and welcome back from the summer vacations. Today's topic is investment materials and casting procedures. Now, casting is basically a laboratory procedure which involves the fabrication of metallic inlays, onlays, rounds, and bridges. So, wherever any kind of metallic restoration or prosthesis has to be fabricated, we do it by the process of casting. Now, basically, casting involves the use of a mold or casting setup in which there is a wax pattern. As you have studied previously, that we use wax patterns for the fabrication of acrylic dentures. The same way, these wax patterns, specifically inlay wax, are used for the casting procedure. The wax is burnt out at a high temperature, and this is called the lost wax technique. We will also be studying that in detail. And after the wax pattern is burned out, we flow molten alloy metal under pressure or centrifugal force or uh, at high speed. And what that does is that forces that molten alloy metal into the space or the cavity left by the wax pattern, and it gives rise to your desired prosthesis or restoration. It may be a single unit crown, a single unit bridge, a crown, an inlay, onlay, or multiple unit bridge. So that's all basically what casting is about, and we will be discussing all the uh, now, moving on to the learning objectives, you should be able to understand what casting is and how it is done. So, the technique should be on your fingertips. What is the lost wax technique? The various investment materials, their types, composition, and properties, the setting reactions of these investment materials, the ideal requirement of the investment materials, the types of expansion and investment and how they can be achieved, and finally the steps of investment casting. You should know again, this is related to the technique. You should be able to label the casting ring setup and describe the parts and their uses. And because we're talking about the steps or the technique, so the technical errors involved in investment casting, you should also be familiar with them. Let's discuss the learning objectives. So, first of all, you should be able to understand what is casting and how it is done. What is the lost wax technique? You should know the different investment materials, their types and composition, as well as their properties. The ideal requirements of these investment materials, the setting reaction of investment materials, the types of expansion in investment. Go over some terminologies. Firstly, investing. This is a process of covering or enveloping an object wholly or partially, such as a denture, teeth, wax pattern, etc., with a refractory investment material before molding and casting. Now, investment material. This is the material used to enclose or surround the wax pattern of a dental restoration. And a refractory material is basically that resistant material that is capable of sustaining exposure to high temperature without significant degradation. Now, the best definition of casting is that this is a process by which a wax pattern of a restoration is converted to replicate in the dental alloy. So, the casting process may be used to make dental restorations such as inlays, onlays, crown bridges, and removable partial dentures. The objective of this technique is to heat the alloy as quickly as possible to a completely molten condition, to prevent oxidation by heating it properly with a well-adjusted torch, and to produce a good casting with sharp details by having adequate pressure when the melted metal is forced into the mold. Now, this is a very clear diagrammatic representation of the whole technique. As you can see, we have a die, which is a single replica or positive replica of a tooth with the blue wax pattern. We invest this wax pattern into this ring and we flow an investment material around this wax pattern. It is attached by means of a channel or screw, and what we do is that at high temperature we force the molten metal alloy into this investment ring after the wax is burned out. And if you can see that there is this cavity or wax pattern that is formed by the burnout of this wax. So the metal alloy flows into this wax pattern, and finally it gives us the desired prosthesis or the casting. And that casting is divested. Divested is the opposite of investment, which means it is removed from the ring and it is polished and finished and delivered to the patient. And if we go to the this box right next to the whole diagram, so first we take the impression, pour the dye, do the wax up, then invest it, then burn out, then casting, and a total change, or basically when we get our desired prosthesis, that is the final step. After the impression, there are two techniques by which we can make the wax pattern. You people are all familiar with these two techniques, the direct wax technique and indirect wax technique. Direct wax technique takes place at the chair side and the wax pattern is prepared directly in the mouth. And the indirect technique, obviously, the indirect wax technique, the procedure is done in the laboratory and prepared on the die. Now, the specialized wax that is used in this technique is the Inlay Wax, and you all have seen the wax. It is basically a blue color wax that can be applied to dies to form direct or indirect patterns both for the lost wax technique, which is used for the casting of metals or hot pressing of ceramics. Ceramics we will be discussing later on. It is a totally different and separate topic. Now, two terminologies you must be familiar with, sprue and a sprued wax pattern. The sprue is basically the mold channel through which the molten metal or ceramic flows into a mold cavity. If you can appreciate from this diagram, these are the long green channels present underneath the wax pattern. And the sprued wax pattern is basically the wax pattern which just consists of the prosthesis pattern and the attached sprue network. So these can be said as a part of a casting ring or a wax pattern that has been invested into a casting ring. The lost wax technique. This is a very commonly asked Viva question, and this is a process in which the wax pattern that we have invested into the casting ring is prepared in the shape of a missing tooth structure, and which is prepared in the shape of a missing tooth structure, is embedded or invested in a casting investment, and then finally burned out to produce a mold cavity into which the molten metal is cast. So basically, when that wax is burnt out, this process is called the lost wax technique, and the wax that is burned out, in its place the molten metal is flowed in, and that gives rise to your final prosthesis. During the lost wax technique, how is the wax elimination or burnout done? Burnout is the elimination of the wax pattern from the mold of set investment material, and this consists of heating the investment in a thermostatically controlled furnace until all the traces of the wax are vaporized. So in order to get a good casting or final prosthesis, we have to ensure that all of the wax is burned out neatly and properly, and only then will we be able to get a good, successful, and durable restoration. Look at the casting procedure. We will be sharing videos of this whole technique with you to make your understanding much better. But for now, let's just go over the points. First of all, a wax pattern is prepared. It may be by the direct or indirect technique. Screw is attached to the pattern. Then the whole assembly of the wax pattern or the screwed wax pattern is placed in the casting ring. The investment material is poured all around the casting ring. If you can appreciate the fifth picture, this white material is basically the investment material. The wax and screw are removed by dewaxing, again burnout at high temperature. And finally, the mold is filled with an alloy or ceramic. After the molten metal alloy flows into the cavity formed by the burnout of the wax, it sets and solidifies, and we get the desired prosthesis. We remove it or divest it, and then polish and finish it and deliver it to the patient. So basically, this sums up the whole technique. But like I mentioned, we will be discussing it in detail and showing it as well, and so that will make your understanding much better. Let's move on to the ideal requirements of an investment material. Firstly and foremost, it should be accurate. It should have good reproducibility. That means the investment should be capable of reproducing the exact shape, size, surface details of the wax pattern. It should be refractory. Refractory means it should be capable of withstanding the high temperature of the casting process and maintain its shape and integrity, because we will have to go up to temperatures of 900 to 1450 degrees Celsius. It should have good mechanical strength, high value of compressive strength, and should be able to withstand the stresses that are built up when the molten metal enters the mold. A very important requirement is that it should be able to expand to compensate for the casting shrinkage. As you all know that molten metal alloy, upon heating, obviously it becomes molten, and then as soon as it starts cooling, it tends to contract or shrink. Now, if we don't do anything about that, our final prosthesis that we will get after investment will be undersized because of the shrinkage. So, in order to compensate for this casting shrinkage, we use these investment materials that tend to expand. For example, we studied in gypsum that gypsum, when it is mixed with water and it is undergoing setting, it tends to expand, which is called setting expansion. This, along with some thermal expansion, some crystalline expansion, and other types of expansions we will be discussing, this helps in compensating the casting shrinkage of the metal alloy. So this is a very important requirement. It should be porous so that the buildup gases are allowed to escape easily. It should have a suitable setting time, and finally, it should be able to be easily to break away from the alloy, which means it should be easily divested after the casting is complete. Now, what are investment materials made of? There are basically three types of materials that constitute the investment material. The refractory material, which we, as mentioned, is a highly resistant, rigid material that withstands the high temperature and has thermal shock resistance. For example, it is usually silicon dioxide and its other forms like quartz, tridymite, or cristobalite. Then we have a binder. As the name suggests, its function is to bind together the refractory material, and there are different binders according to the investment material. For the gold casting alloys, alpha calcium sulfate hemihydrate, which is type which is what type 3 gypsum. And for high temperature casting investments, we have the phosphate and ethyl silicate binders. Then there are other chemicals or modifiers like sodium chloride, boric acid, graphite, potassium sulfate, and magnesium oxide. So basically, these three main ingredients constitute the composition of investment materials. And this is a very important question which frequently comes in your prof. So this should be on your fingertips. Let's see the shrinkage in the investment. So the wax shrinkage, the shrinkage of the pattern is about 0.3 to 0.4%, which is negligible. Mainly the shrinkage which is because of the metal alloy, that is most in the base metal alloys. Base metal alloys we will be studying in metallurgy. Basically, they are nickel chromium and cobalt chromium metal alloys. So that's 2 to 2.3%. And in the noble alloys are basically those alloys. I'm sure you know the noble metals, gold, platinum, palladium. So in that the shrinkage is about 1.3 to 1.6%. Is the compensation expansion achieved? Both the binder and the refractory material contribute to the expansion of the investment, and this is necessary to compensate for the shrinkage of the molten alloy during casting and to produce a casting that fits the tooth. How are the investment material classified? They are classified according to the binder. So they may be gypsum bonded, silica bonded, or phosphate bonded. So there are basically three types of investment material according to the binder. If you look at these investment materials individually, the gypsum bonded investment materials are used for inlays, onlays, full alloy crowns, but mainly gold alloys and some nickel based partial denture frameworks. And in this case, the binder is gypsum. So always remember when you're talking about gypsum bonded investment materials, they are used for the fabrication of prostheses made from gold alloys. The phosphate bonded investments are used for ceramic alloy restorations, implant substructures, and partial denture frameworks where the casting alloys with high melting ranges are used, which means that they are used where we need high temperatures. And the binder in this case is magnesium ammonium phosphate. And finally, the silica bonded investment materials, they are used for base metal alloys. As I mentioned, base metal alloys are nickel chromium and cobalt chromium alloys. And in this case, the binder is ethyl silicate. So they have different uses, and basically it is concerned with the temperature. For higher temperature metal alloys, we use phosphate bonded investments and silica bonded, and for lower temperature alloys like gold, we use gypsum bonded investments. Let's go over the investment materials individually. We'll be talking about gypsum bonded investment materials first. So as you can see from the picture, they're supplied as powders and mixed with water. The main composition is basically it is composed of calcium sulfate hemihydrate, which as you all know is gypsum. And if you remember from the classification, this is type 4. This could be type 4 or type 5, which is a high strength, high expansion, and low strength, high expansion investment material. Then it has silica, which as we mentioned is the refractory materials. Calcium sulfate hemihydrate or gypsum is the binder. And then we have modifiers to control the setting time and powdered graphite or powdered copper. So this is the composition of gypsum bonded investment material. Gypsum bonded investment materials, as I mentioned in the previous slides, is used only for gold containing casting alloys because of their low melting range, which is below 1000 degrees Celsius, and it should be never heated more than 700 degrees C, otherwise it will disintegrate at high temperatures. So we have covered the gypsum bonded investment materials composition, properties, and use. So let's move on to the classification. It is classified according to three types. Type 1 is basically based on thermal expansion type, and it is used for casting inlays and crowns. Type 2 is based on hygroscopic expansion, and this is used also for casting inlays and crowns. And type 3 is for casting complete and partial dentures. So basically, this classification is based on the types and its use, and this is very also very important and frequently asked in your exam. Let's discuss the refractory materials, which are mainly silica and its allotrophic forms. And silica is present in about 60 to 65% of the composition, and its main function is to withstand the temperature during casting. Three forms are present: quartz, cristobalite, and tridymite. So, what is the main function? To impart the necessary refractory or resistant properties to the investment. It is responsible for producing much of the expansion which is necessary to compensate for the casting shrinkage of the alloy. So, most of the expansion is taking place due to the refractory material, and this expansion is due to thermal expansion and crystalline inversion. Crystalline inversion or crystalline expansion, how does it take place? So basically in quartz and its allotropes, there is a change in the structure and they undergo inversion. So in quartz, basically at a temperature of 575 degrees Celsius, it undergoes an inversion or crystalline change from the low form or alpha quartz form to the beta quartz form. And similarly in cristobalite, this conversion occurs at a lower temperature of about 210 degrees. So this expansion can be explained by the straightening of chemical bonds, which leads to the formation of a less dense crystalline structure. This change is reversible, and both the quartz and cristobalite can revert back to the low form on cooling. So this overall thermal expansion that takes place when the investment material is setting at a high temperature, combined with the inversion or crystalline expansion of materials, this contributes to the overall compensation expansion, and it is seen that it is greater in cristobalite compared to quartz. can appreciate how the crystalline inversion takes place in both beta quartz and beta cristobalite. In quartz, it takes place at 575 degrees, and in cristobalite at 220 degrees. And in both cases, the beta form is converted into the alpha form, which results in an increase in the volume, leading to an increase in expansion. So this is basically how, due to crystalline inversion, expansion is achieved. When one form is converted to the other, it leads to a resultant increase in the volume and hence the expansion. And this in turn leads to compensation expansion of the casting alloy. Moving to the binder, which in case of gypsum bonded investment material is calcium sulfate hemihydrate, about 30 to 35%, and it reacts with water to form calcium sulfate dihydrate. This effectively binds together the refractory silica, and setting expansion of calcium sulfate dihydrate when mixed with water used to partially compensate for the shrinkage of alloy which occurs on casting. So the gypsum binder contributes to a slight amount in the overall compensation expansion. Now we saw that in the composition there is the role of modifiers as well. So what do modifiers do? Gypsum alone is not a satisfactory investment for alloy casting, so we have to add in certain chemicals or modifiers. Modifiers inhibit shrinkage on heating, the setting time and setting expansion, and this is achieved by sodium chloride and boric acid usually. Let's discuss the very important component of investment materials, which is the expansion, and particularly the setting expansion. Setting expansion is basically there are three types. The normal setting expansion, which in case of gypsum, as you know, when it is mixed with water and it is undergoing setting, there is a outward crystalline thrust that leads to expansion. Then hygroscopic expansion, people are also familiar with this, that this is the expansion that takes place underwater and which is more than the normal setting expansion. And finally, the thermal expansion, which takes place in case of investments when we are heating to a high temperature. The purpose is mainly the same, to enlarge the mold to compensate for the casting shrinkage of the molten alloy. About the normal setting expansion that takes place in gypsum investment material. There is a linear dimensional change as the investment sets, and the presence of silica particle results in even greater setting expansion. Now, how is that achieved? The silica particles interfere with the intermeshing and interlocking of the gypsum crystals, and this results in an outward thrust of crystals, resulting in even greater expansion. So the gypsum and silica together, they contribute to even greater expansion. type of expansion, hygroscopic expansion, as the name suggests, it takes place if the investment is in contact with water from any source during setting. Hygroscopic expansion is seen to be 6 times more than the normal setting expansion, as we studied in gypsum. Water causes the particles to separate, hence creating the greater expansion. Now, how can you achieve hygroscopic expansion? There are basically 3 ways or 3 steps. Firstly, by placing the investment mold into water at the initial stage. Secondly, by adding water onto the upper surface of the investment material in the casting ring at the set stage. This is called controlled expansion. And thirdly, what you can do is you can line the casting ring with a layer of damp asbestos, and that is able to feed the water into the surface area of the investment mold. So basically, there are 3 ways by which you can achieve hygroscopic expansion, and this is again a very commonly asked question. Previous slides basically just showed what hygroscopic expansion is, and you people are all familiar with this phenomena as we discussed it in gypsum. So basically now in the investment material of gypsum investment, we have silica as well. And silica, it is seen along with gypsum, results in setting expansion more than with gypsum alone. And although it acts as an inert filler, this interferes with the interlocking and intermeshing of the crystals, and the thrust of the crystals is outward and more expansion is achieved. And this diagram represents basically the difference between setting expansion and hygroscopic expansion, and how by adding water it creates more expansion than the normal setting expansion. Moving ahead, what are the factors that can affect the hygroscopic setting expansion? So firstly, the effect of the composition. The magnitude of the hygroscopic expansion of dental investments is proportional to the silica content. As you saw that the silica content is very important and it is contributing majorly to the expansion. So the more the silica, the more the hygroscopic expansion. Then the fineness of the particle size of the silica, and the more the hygroscopic expansion. So that means that alpha hemihydrate, because it is finer and smoother, it is able to produce greater hygroscopic expansion compared to beta hemihydrate. Then the effect of the water powder ratio. The higher the water powder ratio, the less the hygroscopic expansion, which means obviously when there is more water and less powder in the initial composition, there is less expansion because the expansion is due to the gypsum or the calcium sulfate hemihydrate crystals. Effect of spatulation: as the mixing time is reduced and the spatulation is increased, hygroscopic expansion is decreased. And this is also an important factor to control the setting expansion. So these are the three effects so far that uh, influence the hygroscopic expansion. The shelf life of the investment: the older the investment, the lower its hygroscopic expansion. Then the immersion temperature of the water: higher the immersion temperature, greater the expansion. And finally, the effect of the time of immersion: if the takes place during the initial set, a greater amount of hygroscopic expansion is observed. So basically, these are the six important factors that affect the hygroscopic expansion. The usual thing about gypsum is that it shrinks when it is heated above 200 to 400 degrees. So the silica added provides the refractory properties and also regulates the thermal expansion. Contraction of gypsum at high temperature is counterbalanced and changed to an expansion when silica is added during heating. Requirement for thermal expansion. For type 1 investment, which is based on thermal expansion for compensation, it should not be less than 1% or greater than 6%. And in type 2 investment, which is based on hygroscopic expansion, should be between 0 to 0.6% at 500 degrees Celsius. Material manipulated. The correct proportioning of water powder ratio is 30 is to 100. pre-weighed packets are available, and when mixing, you should be careful that there are no air bubbles. Mechanical mixing is the best, and mixed material is painted onto the wax pattern and then filled into the ring. After the gypsum bonded investment materials, let's move on to the silica bonded or ethyl silicate bonded investment materials. They're also present in the form of powdered quartz or cristobalite, which is bonded together with the silica gel. Preparation, this is not very important for you, so but basically the important thing is the reaction, and the product is ethyl alcohol. And basically what happens is that the slow hydrolysis of ethyl silicate occurs, producing a solid salicylic acid with the liberation of ethyl alcohol as a byproduct. So basically this is the setting reaction of the silica bonded investment materials. Now, when the silica bonded investment material is setting, a small shrinkage is observed during the early stages of heating prior to casting due to the loss of water and alcohol from the gel. This is known as green shrinkage. Now, green shrinkage, this is also a very commonly asked question. And what is green shrinkage? So just remember that this takes place in the silica bonded investment materials when during setting there is loss of water and alcohol, and that results in a small shrinkage. However, because of the presence of silica, there is thermal expansion and crystalline inversion, and that compensates for the slight shrinkage that takes place in this investment material. Ethyl silicate bonded investments do not expand on heat setting the same way that gypsum bonded and phosphate bonded do. So basically, the expansion in these investment materials is comparatively less. Thermal expansion also takes place in the silica bonded investment material. The continued heating, as we gradually increase the temperature, causes the expansion due to the close packed nature of the silica particles. And it is observed that almost an expansion of 1.6% is reached at a temperature of 600 degrees Celsius. However, it is important to note that there is no hygroscopic or setting expansion in silica bonded investment materials. The only expansion that takes place is thermal expansion and some crystalline inversion due to the presence of silica. And last but not the least, the phosphate bonded investments. These are the most popularly used investment materials as they have a wide range of applications and can be used up to for higher temperatures. So they are supplied as powder, which is mixed with either water or a colloidal silica solution. And there are mainly two types of phosphate bonded investments. So basically, when someone asks you to classify the phosphate bonded investments, there are two types. Type 1 is used for fixed restorations for inlays and crowns and bridges. And type 2 for the removable prosthesis. And as you know, the removable prosthesis consists of partial dentures and the cast partial dentures. The composition of phosphate bonded investment material. Uh, Move on to the composition of phosphate bonded investment material. As you can see that it is supplied in the form of a powder and a liquid which are mixed together. The powder consists of the silica refractory material and the binder is the magnesium oxide and ammonium phosphate. Liquid can be water or colloidal silica solution. So let's see what happens when water or colloidal silica solution is mixed with the investment powder. So a reaction between ammonium phosphate, magnesium oxide and water takes place and the final product that is formed is magnesium, ammonium phosphate and water. So if you remember in the learning objectives, I mentioned that all the setting reactions are important. So the setting reaction of gypsum bonded, silica bonded, as well as phosphate bonded investment materials, they all are important, and you should know how to write them down and what the final product is. So this reaction basically that takes place binds the silica together to form the set investment, and it has been seen that the use of colloidal silica instead of water has a good effect that it increases the setting expansion and strength, and it is also observed that hygroscopic expansion takes place if there is a contact with moisture during setting. So as I mentioned, hygroscopic expansion takes place in gypsum bonded as well as phosphate bonded. It however does not take place in silica bonded investment. How is compensation expansion achieved in the phosphate bonded investment materials? On heating the investment before casting, mold enlargement can occur by both thermal expansion as well as inversion of silica, which is also known as crystalline inversion. So there are basically two mechanisms for the compensation expansion. Thermal expansion in strength is greater for the investment phosphate investment that is mixed with colloidal silica compared with that mixed with water. Why are the phosphate bonded investment materials popular? Because they have a multiple usage in casting for the use of base metal alloys, for the use of porcelain fused to metal prosthesis, as they can be used at higher temperatures, and it has shown to have improved removal from the casting, and that is the reason why they are more commonly used nowadays. So if you were asked to sum up the properties, the main properties of investment materials, there will be two things that should be kept in mind. The thermal stability, that means that the investment should retain the integrity at the casting temperature. It should not disintegrate. Mechanical strength, it should have sufficient strength to withstand the stresses that are set up when the molten alloy enters the investment mold. And because gypsum bonded investment decomposes above 1200, this should be kept in mind that the temperature should not be raised above 900 to 1000 degrees. And this can cause severe weakening, leading to incorporation of porosities, which we will be studying later in detail. the clinical uses of these investment materials, let's just summarize. Gypsum bonded investment materials are restricted to use with those alloys, especially gold alloys, which are cast well below 1200, and they constitute majority of the gold alloys and some of the lower melting base metal alloys. Silica or phosphate bonded investment materials are basically used where we have to cast the base metal alloys because of their high casting temperature, and they require the use of, so basically in that case we either use silica bonded or phosphate. So basically phosphate bonded materials may be used for all types of alloys, either precious, semi-precious, or the base metal alloys. Wax burnout temperatures, they are basically according to the type of alloy that is being cast. For gold alloys, 700 to 750 degrees Celsius is the temperature. For palladium silver alloys, it's about 730 to 815. And the base metal alloys, they are cast at the highest temperatures of around 800 to 900 degrees Celsius. Now, in the ideal requirements of investment materials, we discussed that the investment materials should be sufficiently porous to allow gases to escape, and the gypsum bonded and phosphate bonded materials have this property. However, the silica bonded materials, because they are closely packed, they are porosity free, and there is a danger that the pressure may build up inside, which can cause the mold to be incompletely filled or casting to be porous. So, what we have to do is we have to physically make holes or vents in the investment ourselves so that this prevents the buildup of gases during the casting process. Different metals shrink at different rates. It is seen that the most shrinkage takes place in cobalt chromium alloys, which are base metal alloys, and the least takes place in gold alloys. And this is why we have to do the compensation expansion. So by now, the different investment materials and their primary use, properties, and composition should be very clear in your mind. Let's go over them. This is a table that I made for the ease of remembering. Rental plaster or stone or gypsum, basically investment was used for acrylic dentures fabrication. Gypsum bonded materials for basically where we have to do the casting of gold alloys. Silica bonded materials, now they're rarely used because of the main fact that it produces ethyl alcohol as a byproduct and it is not porous enough, that was used for base metal casting alloys. And phosphate bonded materials, which as I mentioned is the most popular investment material because of the fact that it has a variety of uses. It can be used for mold make for base metal as well as gold casting alloys, for the castable ceramics and glasses, and refractory dye for ceramic build-ups. And that is why it is the most commonly used investment material. So we are done with the basic investment materials, which includes the composition, properties, requirements, as I mentioned, the expansion, compensation expansion. So now we will proceed to the actual procedure or technique of casting. And we'll show you videos as well so that your understanding gets better of this procedure, which is a purely laboratory procedure and a complex one. We're unable to show it to you in the college, but we'll be showing you videos which hopefully will help you understand this procedure much better. So in the initial slides, I did discuss the steps of the investment of the casting procedure. First of all, obviously the tooth preparation, which you carry out in the patient's tooth, and then the impression, then dye preparation, Then the wax pattern fabrication. It may be direct or indirect. And then spooling, which is basically attachment of the pattern to the casting ring. As you can see from the diagram, this red thing is basically the wax pattern, and by means of a long thin channel, which is called the sprue or the sprue former, we attach it to the crucible or the base of this casting ring, and this whole setup is basically a casting assembly. Now this diagram is very important. You should be able to identify and label all the parts of this casting assembly. um, the sprue former may be made of wax, plastic, or metal, and a reservoir is attached to the sprue. Very important technical consideration is the fact that the length of the sprue should be 3 by 8 to half inch. And we'll be dealing with all these clinical or technical parameters later on. So just try to remember this diagram as you may be asked to label it. Go over the steps of casting one by one. As you can see from the first picture on the right, that this is a prepared tooth, and we prepare it accordingly. Make an impression of the prepared tooth. and then pour the dye, and which is a positive replica of a single tooth. Then what do we do next? Step involves the making of the wax pattern that represents the lost tooth structure. It may be by the direct or indirect technique. Then the wax pattern is screwed or fixed in the casting ring assembly, and this is done by means of the screw or the wax channels. And the arrangement of the pattern in the ring should be proper, and all the technical considerations should be taken into mind. The length, the distance from the top, all of these things we will be discussing later on. It is important to know that the screw is attached onto the cuspal area that is least involved with the occlusal function. Again, these are all technical considerations. and then the sprue is attached to the rubber sprue base with wax and placed into the casting ring. Now the next step, which is the most important, is the investment of the wax pattern with the desired investment material, which we studied. There are basically three investment materials, and that is obviously selected according to the alloy being used and the casting temperature that we are going to use, and according to that the investment material is selected. As I mentioned, this diagram is very important, so have a good look at it and try to remember. This is the parts of the casting ring. Back to the technique of casting, we talked about sprueing. This is a very important step, although you won't be asked to do this at this level, but you should have some knowledge of the technical aspects. So basically, there are rules of sprueing, and it says that you should use short and thick sprues that prevents the spot porosities and localized shrinkage porosities. We should attach the sprue to the bulkiest pattern of the part of the pattern, and never feed the molten alloy through a thin section. So after you have sprued the wax pattern and invested it, obviously the next step is the burnout, when by which loss wax technique we get rid of the wax and in its place a cavity is formed. And the next most important step is basically the melting of the alloy and subsequent flowing into the sprue channels and into the wax cavity so that your desired prosthesis is formed. Casting machines have an inbuilt furnace that you simply put in the alloy and they melt that alloy and convert it into a molten state, or you have to do the melting yourself by using a blowtorch. And an important thing is that the reducing flame of the blowtorch is used. We never use the oxidizing zone, which is the outermost zone. The reducing zone is used, which is the blue zone. If you look at the flame carefully, there is a blue zone, and this is the hottest. It has the highest temperature. And the other procedure is by the use of an electricity or an electric heat source. Now, these are different casting machines. They may be of three types dependent on air pressure, centrifugal, or induction casting machines. And they all use heat source to melt the alloy and generate a casting force by which the molten alloy flows into the mold cavity, and solidifies and sets and forms the desired prosthesis. After casting is complete, divestment and pickling is carried out. Divestment is basically the removal or retrieval of the casting, by which we remove the casting or the prepared prosthesis from the investment. Uh, the next step is pickling. This is a very commonly asked MCQ, that what is pickling. So basically pickling is when we in order to get a smooth surface and to get rid of the discoloration that may be present due to surface oxides on the casting, we dip the casting into 50% HCl. So this process is called pickling. Now the casting is ready to be finished and polished, and but before that we have to remove it from the sprue, and then after we remove it from the sprue, we carry on with the finishing and polishing. So by now we have covered the investment materials and the casting procedure, and finally we will end with discussion of the casting defects or the different errors that we may encounter during this whole process. The most common and important casting defect is porosity. Porosity may be internal or external, and external porosity causes discoloration and aesthetic issues, whereas internal porosity weakens the restoration and compromises the mechanical properties. These porosities have been classified for convenience, and it's very important that we are able to identify and recognize these porosities and the reasons or the cause of these porosities and how to minimize or get rid of them. So there are basically three types of porosities. The ones that are caused by solidification shrinkage, which includes the localized shrinkage porosities, suckback porosity, and microporosities. Those caused by entrapped gases. They may be pinhole porosities, gas inclusions, or subsurface porosities, and those caused by air trapped into the mold that is specifically called back pressure porosity. Now let's discuss the localized shrinkage porosity. This appears as large irregular voids and they are commonly found near the sprue and the casting junction. And the reason for this type of porosity is when the cooling sequence is incorrect or irregular. If the sprue solidifies before the rest of the casting, no more molten metal is able to travel from the sprue, which can cause voids or pits. So this is basically the premature termination of molten metal during solidification, which means that it cools before its time, and that leads to large irregular voids found near the sprue casting junction. Localized shrinkage porosities is very important. You should know why it is caused and how it can be prevented. So it can be prevented by using a sprue of the correct thickness. That means if you increase the sprue thickness, you can overcome it. Decrease the length of the sprue, increase the melting temperature, increase the mold temperature. Attach the sprue to the thickest or the bulkiest portion of the wax pattern. Flare the sprue at the point of attachment and place a reservoir close to the wax pattern. So basically, these are a few uh, tips or steps that you can take to overcome or prevent the localized shrinkage porosity. Type of porosity is known as Softback porosity, and if you can see from the picture, it is visible as an external void inside the crown opposite the sprue. This is due to the creation of a hotspot due to the metal impinging onto the mold surface, which creates an area of high temperature. Now this area freezes or solidifies it at the end, and that is why this kind of porosity is created. It is seen in the interior of the crown near the sprue at the occluso or the inciso-axial line angle. How can it be prevented? By reducing the temperature difference between the mold and molten alloy so that this hotspot is not created, and by flaring the point of sprue attachment. Now all these porosities are important, but you just have to know their names. What is the reason or cause that they are of these porosities, and just 2-3 points of how they can be avoided. moving on to the gas inclusion porosities, this may be due to entrapment of gases during the solidification, or maybe due to dissolved gases or gases carried in or trapped by the molten metal. Reason may be a poorly adjusted blowtorch or use of oxidizing flame. As I mentioned that we are supposed to use the reducing flame. This can also cause occlusion of gases. How do they appear? You can see from the picture. There are small bubble-like representations, and the casting appears black and does not clean easily on pickling. Now it is seen that some molten metals absorb gases which are released upon solidification. For example, silver tends to dissolve oxygen, and palladium and platinum absorb both hydrogen and oxygen. So this leads to pinhole porosities. You can see from the picture that these are tiny, minute, pin-like craters within the casting, and they're evenly distributed but smaller than the gas inclusion porosities. Another type of porosity is known as subsurface porosity. This is caused by simultaneous nucleation of solid grains and gas bubbles when the alloy freezes at the mold walls. Prevention can be done by controlling the rate at which the molten metal enters the mold. It is increased by increase in the screw thickness, increase in the melt temperature, and increase in the mold temperature. And it can be reduced by increase in the screw length. So that is one way that it can be prevented. The entrapment of air and inadequate venting of mold can lead to back pressure porosity. Also, when the casting temperature is low so that solidification occurs before the trapped air can escape, this also leads to the back pressure porosity. How can it be avoided? As I mentioned that there is a certain thickness that the screw should be kept at, and uh, so that the screw pattern length should be adjusted so that there is not more than 1/4 inch thickness of the investment between the bottom of the casting, and the thickness of the investment between the tip of the pattern and the end of the ring should not be more than 6 millimeter, and by ensuring that there is proper burnout of the wax pattern and a sufficiently high casting pressure. All these steps, if they are followed, this kind of back pressure porosity can be easily avoided. have covered all the porosities that can be present in a casting, and this is a very nice table that you can easily find in your textbook, both of the textbooks, Phillips as well as McCabe, in which the type of porosities, along with the effect of the technical factors like the screw thickness, screw length, melting temperature, and mold temperature, the effect it has on the porosities. So this will be very helpful in remembering and memorizing the porosities and the factors that they are dependent upon. So there are other errors that may take place in your casting. Apart from porosities, there could be incomplete casting, and which may be due to insufficient casting pressure, incomplete elimination of wax if you used a lower liquid powder ratio, or the viscosity of the fused metal. There could be distortion of the casting, which is usually related to distortion of the wax pattern. It can basically be due to stress relaxation when there is a change in the temperature. So, as you know, that stresses are being released within the structure. It can occur during the investment procedure. Um, how to minimize it? By application of minimum pressure, manipulation of wax at high temperature so it's properly burned out, by investing the pattern immediately, and if storage is necessary, to store it in a refrigerator and prevent basically extreme temperatures. Be that due to rapid heating, there could be the formation of fins or spines or flaking of the investment. So this can be prevented by gradual heating, at least 60 minutes from room temperature to 700 degrees. The greater the bulk, the more slowly it should be heated to prevent these kinds of errors. Formation of air bubbles, which are small nodules on the casting. This can be prevented by proper investment technique, mixing preferably under vacuum or vibration, and application of a wetting agent so that air bubbles are not formed. Water films can be incorporated if water or moisture is incorporated into the wax pattern. can be prevented by use of a wetting agent and correct liquid powder ratio so that the liquid part is not more than the recommended amount. So there are various errors that may be present in your casting, and you just have to know the names and the basic reason they occur and how they can be prevented. That is more than enough for you at this stage. So class, this brings us to the end of our topic, which was investment materials in casting. We have covered all the learning objectives and I hope it's all very clear. If you have any questions, please feel free to ask me. Thank you so much.